President, I come to the floor today, as I have week after week since the health care law has been passed, with a doctor's second opinion about the law that I have great concerns with. And I do that as a doctor who practiced medicine for 25 years, took care of families all around Wyoming, was involved with a number of different programs aimed at prevention of disease, early detection of disease, early treatment of disease. So I come to the floor today to talk specifically about a portion of the health care law that's been discussed quite a bit in the last week or two on this Senate floor. Congress has talked a lot about the so-called Prevention and Public Health Fund, which is included in the President's health care law. And, when I looked at this health care law initially and continue to look at it today, I continue to ask the question, does this health care law the best to give patients the care they need from a doctor that they want at the cost they can afford? And I believe it has failed on so many ways to do that, which is why I continue to work to try to repeal and replace this health care law. But when we get to the specifics of this public health fund and prevention fund, the President and Democrats have claimed that the purpose of the fund, the purpose was to promote wellness, prevent disease, and protect against public health emergencies. Well, all of us want to promote wellness, prevent disease, and protect against public health emergencies. I know how important those things are as a doctor. I know how important it is to the point that for over 2 decades in Wyoming, I was medical director of a program called the Wyoming Health Fairs, where we have provided low-cost health care screenings to people all across the Cowboy State. It's a very important program, and people continued to write letters to me over the decades. The fact that by going to a health fair, by learning about how to prevent diseases, by early detection of problems, they feel that either they or members of their families have had their lives saved as a result of these services that were provided all throughout the communities, aimed at prevention, aimed at early detection of problems. Tests like blood pressure, PSA test, people learning about how to examine themselves, how to get a mammogram, a low-cost or free mammogram, all of these things aimed at giving people information for prevention. And these gave people the tools that they need, to make decisions about their health and their health care, and not just the patient, but also to help their medical providers. So I come to the floor today to say that instead of helping Americans prevent health problems, the President's new law actually uses this so-called prevention fund as a Washington slush fund. In fact, the new health law provided about $15 billion for this fund from 2010 to 2019, and then beyond that, about $2 billion every year in annual appropriation of funds received to go toward this same slush fund forever. $2 billion a year forever. Who's going to control the fund? Well, the Secretary of Health and Human Services. And even though this law has only been in place now for 2 years, we've already witnessed how the Obama administration officials have allowed this money to be wasted. Among other things, we hear of a health clinic using the funding to spay and neuter pets. That's right, to spay and neuter pets. Another state's Department of Health used $3.6 million to create at least 4 regional food policy councils. And taxpayers are going to be happy to learn, not so happy, of course, to learn that their hard-earned money helped the one county in California secure a ban on new fast food restaurants. Well, nothing against a food policy or spaying and neutering pets, but when the United States government is borrowing approximately 40 cents out of every dollar that we spend, when we have a national debt in the area of $15 trillion, Washington should not waste Americans' hard-earned taxpayer dollars, but we continue to do it, and this fund is a key example. According to the nonpartisan Congressional Budget Office, eliminating the prevention fund would save about $13.5 billion over the next 10 years. The fact is, Congress already funds many prevention programs with a proven track record of success. Examples include cancer prevention, tobacco prevention, host of other problems. So Republicans have supported and will continue to support these critical prevention programs: cancer prevention, tobacco prevention, working on heart disease. However, the record is clear that the so-called prevention fund in the health care law is wasteful and duplicative. It doesn't help the people stay well or become well. Now, Senator Alexander from Tennessee has introduced legislation that would eliminate this slush fund and use the savings to maintain student loan interest rates at 3.8%. Under current law, students who receive subsidized Stafford student loans will see their rates increase shortly to 6.8%. Now, unless, of course, Congress acts, and I'm ready to act. Whether you're Republican or Democrat, liberal or conservative, people generally agree that preventing this rate increase is an important priority. The difference is, how do we pay for it? The majority leader wants to raise taxes on small business owners. He says that is the better way forward. I disagree. There's a better way forward than raising taxes on the people who create jobs in this country at a time when we have over 8% unemployment, and last month's job numbers are abysmal. Only 125,000 new jobs created, but almost 3 times that many people quit looking for jobs completely. So for every new 1 job, 3 people quit looking for jobs at all. So to raise taxes on people who are creating jobs in this country is the wrong way to go. Senator Alexander's proposal stops the rate increase, which we all want to do, by eliminating this prevention slush fund. His bill uses the rest of the funding for deficit reduction, and I've co-sponsored that legislation. I think it's also important to know that President Obama, has already agreed to use his slush fund to offset other spending. In September of 2011, the President proposed reducing the slush fund by $3.5 billion. In February, part of the payroll tax cut signed by the President contained a $4.5 billion cut from his slush fund. Finally, in March, the President's 2013 budget proposed cutting the fund by another $5 billion. So it's ironic, Mr. President, that the President of the United States and Washington Democrats now oppose using money from their so-called prevention slush fund. If the White House and Democrats in Congress really want to ensure the student loan rates stay low, they'll cut this wasteful program and use the money to help the next generations of Americans. What we do know is that young people coming out of college today are, on average, having a debt of about $25,000. And whether the interest rate is 0 or 3.4 or 6.8, they are still coming out with a huge debt at a time when we know 53% of people coming out of school can't find a job or can't find a job consistent with their level of education. We read that 40% of them are actually going home again to live at home, returning to home instead of going out into the workplace. So it's time to focus on the economy. It's time to focus on getting people back to work, and time to agree that we need to keep the interest rates low, and we ought to pay for it with money that is there, that can easily be used, and we shouldn't be raising taxes on job creators at a time with a country in this sort of economic condition. And so, Mr. President, I continue to come to the floor week after week to talk about findings in the health care law, some things unintended consequences, some things money tucked away for other purposes, because I think it's hard for Americans to ever forget Nancy Pelosi saying, first you have to pass the health care law before you get to find out what's in it. And the more the American people find out what's in it, the less they like it, to the point that most recently 67% of Americans felt that the health care law ought to be found totally or at least partially totally or partially found unconstitutional as the Supreme Court looks to make their ruling in the next weeks and months ahead. This is a health care law that, in my opinion, is bad for patients. It's bad for providers, the nurses and the doctors who take care of those patients, and it's terrible for American taxpayers. And this is a time we need to repeal and replace this health care law. And now there is a way to use one of the provisions within it to fund and make sure that we do not raise interest rates for the students in this country so they can get the education that they need and hopefully find a job and not punish those who are trying to provide those jobs to these graduates. Thank you, Mr. President. I yield the floor.